Pre-med students, the most common format that we like to type up notes or present patients when healthcare professionals are talking to each other is the SOAP note format, right? SOAP. S is subjective, O is objective. So that's, and I'll go through each of them. A is assessment and plan, or sometimes we call it assessment and recommendations if we're consulting on the case. The subjective part is usually what the patient feels, it's their perceptions, and it's the story, it's the onset, it's the 5 W's and the H. And so that's the story is with the subjective. The objective, we usually like to start with vital signs, but it's the third-party data that we use to gather information. It's our physical exam on the patient. It's the physician's perception or perspective on what they see in the patient. It's labs, rads, it's the data points. The assessment and plan is where we put it together. We grab all that information and we call it the synthesis in medicine. That's where we synthesize and we analyze the information and we come up with a diagnosis or a differential diagnosis. If you watch House, the differential would be the possible other diagnosis. We like to rank order them if it's a very complex case. And then what are we going to do to evaluate said diagnosis or potential diagnosis? And that would be the plan. If we're being consultants, we'll give recommendations at that point. And that's the format you'll see in most notes. Some of us are a little bit more advanced and we like to just put the assessment plan up front. This is the format that we're traditionally taught in medicine, and I want you to get used to that as you rotate with me in my clinic. I'll see you at the next video.